Well, hello, my name is Antoine Geissbuhler. I'm a professor of medicine at Geneva University, and I'm also leading the e-health and telemedicine division at the Geneva University hospitals. So I've been involved for quite many years in developing telemedicine systems, in particular for developing countries. We're actually running one of the largest networks dealing with distance education and tele-expertise in 25 countries now, mostly in sub-Saharan Africa, but also in Latin America, in Asia. And obviously we've been heavy users of satellite communication because the places where we are providing those services are remote places. We're trying to de-isolate care professionals who live in those remote areas. And so to reach them, you need to have connectivity, and to have connectivity, at least until recently, the only option was satellite. Things have changed a bit, as you know, and now there are different ways to get access to the internet, using mobile telephony, for instance, which is a major development. But I got interested in the role of space technologies, and actually they can make a difference in terms of global health, and that's going to be the topic of my talk, really trying to connect what we can get from space-based technologies to actually achieve sustainable development goals. And the one, obviously, that I'm interested in is goal number 3, about access to health and universal health. Now, communication is obviously one of those technologies. The other technologies are the ability to do remote sensing and observation from the space to actually understand what is going on Earth. And obviously for health, and especially for public health, this is quite important, because you need to be able to spot the places where mosquitoes are going to breed so that you can fight them to prevent some diseases. You need to understand the link between the humans, the ecological environment, and those things seen from space can be very informative, in particular when they're connected with observation that you do on the ground. When you're on the ground, you're happy to be localized so that you know where you are, and this is also another space technology that has an important role to play. It's the global navigation satellite systems. And obviously we're using a lot of that, especially as we're trying to bring all this data together in what we call big data, and be able to extract knowledge from all these sources of data that are connected, those that come from space, those that come from the ground, those that come from the patients, and so on. And finally, there are situations of isolation that are even worse than the doctors we're trying to support in Africa, and those are the astronauts in space. And so technologies that have been developed for isolated settings, such as like the International Space Station, could actually be made useful also to work in isolated places on Earth. So those are the kind of things we're working on. We believe that the more data we make available openly, the more creative and understanding we can get from this data. And this is something that I think the space community has understood quite well, that the medical community needs to understand. And those are the things we want to discuss. I'm a co-chair of an expert group on space and global health at COPUOS. And so I've been tasked to actually increase the links between the space people, the health people, and the NGOs and the international organizations who deal with this. And that's what I'm going to do also today. And finally, we are also trying to understand the scope of projects and activities that can connect space and global health, and we're currently doing a relatively large survey that hopefully we'll be able to publish soon. So voilà, in a nutshell, this is what I'm doing, and I'm excited to be here. Thank you.